Hello and welcome to the podcast. I'm Dr. Christopher Nolikin.
And I'm Dr. Lindsay Renzulo. We're doing our podcast today like you're seeing most people doing things now remotely. So we apologize if there's any audio issues, but we're hoping that this will be a fun remote issue for you guys.
Yeah, so, like everyone is talking about the coronavirus, so we are no different than that. But we're hoping to talk about some kind of more fun pet-associated topics, really tangentially related, I guess, to the coronavirus. We'll start out, though, with a little briefing about our hospitals, specifically for those of you that are actually clients of our hospitals, and what we're doing in order to keep ourselves and the public safe. So, Lindsay, do you want to talk about that?
Yeah, sure. I mean, like all of us, we're trying to make sure that we maintain the health of our safety of our employees, our clients, and our pets. And so we have started to sort of put in various protocols in place to make sure that we minimize contact and try to hopefully help prevent or eliminate the chance of the disease spreading throughout the hospital. So currently, if you come to Bulger, what you'll do is when you drive up, you'll actually notice that as a client, you no longer will be entering into the building at all. There are parking stations right in front of the hospital, as in all the hospitals around with Ethos, and there's numbers that you can call. So as soon as you sort of pull into your parking spot, you call the number and you'll be connected with somebody inside the building. From there, you basically will talk to somebody inside the building remotely, so on the phone. So we'll be getting our history, talking about what's going on with your pet and why you're there the day, all over the phone, so we can, again, minimize contact. And then a technician will come out and take your pet into the hospital where the doctor will perform the exam. And then doctor will give you a call back with findings and sort of the next best steps. So we've got these curbside check-ins, which are really sort of taking place with a lot of veterinary hospitals and practices. Inside, we have PPE, so we're having our technicians and our doctors and our client care all wear face masks, gloves, and other protective equipment when appropriate. And we also are working in teams. So we're trying to keep certain team members always together or working in pods. So that way, if heaven forbid a team member gets sick, we're sort of keeping it within that isolated group as opposed to spreading it amongst the whole hospital. And then we even have things where we're having pets that are admitted into the hospital that we're trying to isolate depending on whether or not they currently are in a house with a COVID positive person. So we're having different types of cage cards listed on each cage, whether or not that pet is a high risk pet or a low risk pet. So we're informing our staff of ways that they need to protect themselves if they're going to be interacting with that patient.
And from a perspective of cases, so we definitely are limited in exactly all of the specific situations that we can see pets. So we can see emergencies and we can see urgent sick pets for sure. For well pets, we have put a temporary moratorium on seeing well pets except for those that have what we deem as more critical vaccinations. So any puppy, you should come on in. We don't want to have a bunch of unvaccinated puppies out in the world. We don't need to have other disease outbreaks occur. New pets that are not up to date on their vaccines that you just may have adopted, those guys often are not fully vaccinated and they should be. And then certain vaccines, rabies for sure, Lyme and lepto are two other diseases that may have ramifications for the pet and for the general public if we don't keep those pets up to date on their vaccines. So those three are exceptions for dogs and cats that are due for the rabies and dogs that are due for Lyme and lepto. We are seeing those. We do sometimes have more limited appointment availability for those well cases because certainly it's not as time sensitive as if your dog is vomiting or if your cat is, having diarrhea, let's say, in your quarantine situation. So
it's not pleasant for anybody.
No. From a surgery standpoint, all of the routine surgeries, we do them really on a case-by-case basis. So if a dog is 5 months old and the owner's itching to get it spayed or neutered, we might have to tell you that you're going to have to wait a little bit. But if a dog, let's say a female dog, is reaching maturity, or a cat, and we're worried they're going to go into heat, then we will go ahead and do that. And for neuters, let's say your male dog starts pumping everything and peeing all over the house, again, an unpleasant situation while you're in quarantine, we will, on a case-by-case basis, book those, but they have to be run by a doctor first. So that's kind of how we're handling those things.
And the other great feature that we're sort of utilizing that we haven't done before, but this crisis has really brought about, is telemedicine appointments. It's an awesome way to connect with clients and to have a more comprehensive exam over the phone with a vet, where we can utilize pictures that clients can email in to us and even videos, and be able to help really diagnose some certain conditions over the phone, give treatments or medications that we can send out to pharmacies or have it at the hospital to pick up. But again, trying to minimize, contact and still give the best possible care to the pet.
Yeah. So then, another topic we were sort of talking about in terms of the coronavirus is, everyone's seen in the news these reports of the tigers at the Bronx Zoo getting coronavirus. So that's an interesting situation where I guess a handler, one of the zookeepers, actually was an asymptomatic positive for coronavirus, at least at the time that they were managing those big cats. And I think all but one of the tigers and some of the other large cats were displaying some upper respiratory symptoms. Interestingly, it appears that because those animals are not the target species for this coronavirus, that their symptoms were very mild and very transient. So, but they did get it from their handlers. There's been a couple of studies out now about other domestic species. So there's this one report that we mentioned in the last podcast of a dog in Hong Kong testing positive. That is to date the only dog that has ever, I believe there may have been one other one, but it's not at all common in dogs. There's a study now where people experimentally tried to infect dogs and were really unable to produce any virus shedding or disease in dogs. So we're pretty confident that dogs really can't catch this. And then cats, they did the same thing with cats and ferrets and were able to produce mild disease in the cats and a little more severe disease in the ferrets. The ferrets of all the species appear to be the most susceptible. That was with very high doses of the virus given to them directly, so it doesn't necessarily mimic what happens in real life, but cats and ferrets theoretically can get this. I want to just caution people that this is not a reason to go and give your cats and ferrets up for adoption. If they get it, they're getting it from you. So just to be clear, you're not getting it from them. But it certainly raises concerns with us as veterinary workers that if we have a cat or a ferret that's displaying similar symptoms, then we would take those precautions that a human healthcare worker would take to protect ourselves from those animals, because they actually may have it. Typically, they're coming from a household that also has it, so we would know that also. But
yeah, and I think it just brings light to, if you are positive for corona, the CDC does have guidelines of just trying to minimize, your handling with your pet. Again, it's not, it's more to protect your pet from you at this current moment. You don't want to give your pet something that you have. They're not going to be a major source of potentiating this disease in the population. That's all going to be human community spread. So just to echo Dr. Bernalic, and not to necessarily feel like you need to start going and, giving all your pets up for adoption. That's not what we want to have happen at all.
So then the third topic that we have is kind of an interesting one. We've both seen, I think, a lot of clients who are adopting pets during this time. You're home. You've got plenty of time on your hands sometimes. I don't know about you, Lindsay, but I don't.
No, with 3 kids trying to homeschool and work, no.
No, but that it might be a good time to adopt a pet. What are your thoughts on this, Lindsay?
So I do. It's almost like I can see both sides. I really can. I do think it's a great time, in a lot of ways, where you can really dedicate your time to a particular pet to teach them house training, simple commands, really get them acclimatized to your home and a routine, which is great. And there's really not going to be that many times in life that you're really going to be able to have so much downtime that you can dedicate to your pet, to your pet. So I do think in some ways it also gives people like really something fun and happy to do. And sometimes it's so mundane, there's limited places we can go. limited things you can do. You can only organize your closet so many times, and then you get, need to do something different. So I do think that for people, I think it's an awesome outlet. I really do. I guess my only downside of it, and maybe you agree with me with this, is that is just the lack of socialization that you can have that pet have when they're in your home. So obviously you can't bring your pet to a dog park and, get them interacting with other dogs, or you can't go to puppy school or socialization classes. And that's the only major downfall that I can really see. I think your pet will get used to having you home, and it might be sad when you do go back to work eventually, but just that lack of socialization at this time, I think, is the only downside.
Yeah. And I guess the other thing that I thought of with this is, before you do this, actually, you should call your family vet or the vet that you're going to choose and make sure they're actually seeing puppies, right? Yeah. So if you live around here, I'm sure that you can find a vet that will do the puppy vaccinations, even though some have closed. Like, some general practices have just straight up closed. That doesn't mean that you can't find one that would be able to do it for you. But if you live in maybe a more rural area, you might not have a vet around that is open, that could see you for this. So, you might only have emergency hospitals, and they will not vaccinate dogs. So that's something to check in before you get a puppy. I think an adult dog that you might adopt now is different with the socialization, right? Because they're kind of baked in.
Yeah.
But I actually have really significant concerns about the puppies. The ones that I'm seeing right now, they're lovely little dogs, but a lot of them are just like, they're not going to get the socialization that they need, because what they need is to be meeting lots of other people, experiences, and other dogs before they are 16 weeks old. So if you get a 12-week-old puppy now, that isn't going to happen. And some dogs will be fine with that. Like, some happy labs won't care. But there are dogs that are going to come out of this fearful of everybody. So it is something to think about. I had an owner yesterday ask me, well, can I set up a play date where I stay away from the people and the dogs just play? The CDC would tell you, no, you should not do that, right? Mm-hmm. You shouldn't be setting up play dates, even if you think you can stay far enough away from people. So you just can't, and that is hard. But it is a good time to be home with them and get them all trained up and get them, learning all their commands. That's great.
And as far as cats go, I think right now is probably one of the best times to, get
a cat. Totally.
Yeah, if you want to get a cat. Because, cats don't need that massive socialization with people and other cats, that they're going to be staying inside with you majority of the time. So getting a cat right now is awesome. I think if you want to get a cat, right now is the time. You actually might have a hard time finding a cat, to be honest with you, because some of the shelters have. But yeah, definitely check around with your local shelters, because getting a cat's a great time.
I was just going to ask, you probably were getting into it, but what about fostering? Have you heard anything about that?
Yeah, so I actually haven't heard a lot about fostering, although it sounds like a very excellent time to do that, right? So, but I will say that the socialization part is still part of it, right? Because an adult dog that you might be fostering, again, they are behaviorally often very baked in, and that's they are what they are, and it's going to take many, many months to change their general socialization, so it's fine. But they also, you're not going to have an opportunity to introduce them to other animals or anything. But on the flip side, you have time to devote. Fostering is a slippery slope. You have to be prepared that you might keep that, there's this thing called failed foster, and anyone who's ever fostered a dog, what are the percentages, Lindsay? I think at least 50% of people who foster animals end up keeping that animal. So just be ready for that.
If you're not a pro-fosterer, some people I feel go out there and they're pro-fosterers. This is sort of their calling. They feel a really strong connection. Even though they'll get the occasional failed foster, they do a fairly good job at sort of getting these dogs acclimated, figuring out their personalities, and being able to house them accordingly. If this is the first time that you've ever fostered and you want to give it a go,
you're going to keep that dog.
High likelihood you're keeping that dog. Yeah.
Well, and then the flip side too, I don't know how these fosters are actually working with the guidelines of social distancing. So, and this is a genuine thing that I don't know. How do you get the dog and find out that the dog needs to be fostered. I guess that can all be remotely. And then how do you, now you actually kind of are stuck with that dog, I guess, or cat. I don't hear a lot about fostering cats as much, but fostering the dog, you can't have people coming to your house to meet that dog. So you're a little bit stuck with the dog until our social distancing guidelines are relieved, and that could be, according to some people, soon, but I don't think it is. So realistically, you probably have to be prepared to keep that dog for a few months at least, because you shouldn't be having random strangers come to your house to meet the dog, right? No. So I don't actually know how that works.
Yeah.
If you weren't going to socialize your puppy anyway, which we wouldn't necessarily recommend, but a lot of owners don't actually provide their puppy with very much socialization, then those puppies will not have a difference right now. So I suppose, they're fine. Like I have, one person I can think of that really doesn't value socialization, and, her dogs, they're fine, but they're a little crazy when they come to the vet and when they meet new people and stuff. And that's because they didn't really meet a lot of people as puppies, and she doesn't intend to do that with this puppy anyway. So that's okay, right? That's no different.
Yeah. Right.
Yeah. I mean, it's not necessarily what we recommend. We really try to get our owners to get their dogs out the minute they get that puppy, but not everybody does that. So.
Yeah, it is true. I think it's, your pet is what you want it to be in some ways. In other ways, you can definitely do things to help make it become a, more socially appropriate in different situations. And so right now is a tough time to get the socialization that they need.
What else, Lauren? Do you have any other topics?
Yeah. So both of you have pets. So have you been doing anything while you're in kind of isolation to do anything new? Maybe learn a new trick, maybe do something different with them?
But, I know we talked about it earlier about, the CDC says minimize the contact or try to not have the animal as much in your face. It's really hard. Like I would find it to be very hard to do to not.
If you were positive,
not to be, I was thinking about it. Like if I'm feeling sick, not to have her in the bed and kissing and loving on her. So it would be difficult to do. So I can definitely see where people would struggle with that. We have not done any new tricks. No. Have you done any new tricks, Krista? No.
No, I mean, the dog gets more walks because that is one of the assigned tasks that my children can do when we are trying to keep them on some kind of a schedule and not continuously on their computer screen. So they do take the dog for more walks. And from a training perspective, actually, that is good for my particular dog who happens to be not well socialized, and I don't blame myself for that because I got her when she was 1 year old. So, and she's deaf and she has some weird little personality quirks, but she's sitting by my feet right now. She definitely enjoys taking more walks. She's more tired than usual because of it. So she's over the moon that we're home all the time, and she gets to snuggle with us and sit with us all the time, getting more play than usual. I have not tried more tricks because getting this dog to do any tricks is like, oh my God. But I could give that as a task to my kids. Like, okay, now we're going to teach the dog to give paw. Maybe we should do that.
It's a good idea. We've given
that would be fun.
More baths, for sure. More baths, more hair trims because they like styling her hair.
And you can't bring them to a groomer because that's not an essential service.
No,
right.
Yeah. She looks like a hot mess, but yes, yeah.
Well, Luca and I, we tried to do some new tricks, so we got Whisper down.
Whisper?
Oh.
Whisper, yeah. So we had Speak, but we use it as Use Your Words. So Use Your Words is a loud bark, and we just added in last Friday Whisper, and he's
awesome.
Nailed it.
Oh, well, that's awesome.
No, I don't think that Lucy's not really smart enough for that. I mean, I love her.
Well, Lucy has,
she can't hear
that's harder to train. Yeah, that's much harder to train because you're using sign language as well as training.
Right.
Yeah. That's hard.
Yeah.
Oh, and I was actually going to mention that whole grooming thing. Like, one question that we are getting an awful lot of is, my dogs or cats' nails are out of control, and will you trim them? And there's mats, and we need them shaved. The reality is that per the rules that our state government has set forth, that's still not considered essential. So, because realistically, and I know this is a hard thing to say to a lot of owners, like you can trim your dog's or cat's nails yourself. And I know that that's not actually real, that some people can't, and their cats or dogs are not amenable to that. In general, though, you can't just bring your pet in as you used to be able to do and have us trim the nails. If it's really getting to be a bad situation with, nails growing around into paws and that kind of thing, then you can set up an appointment and we'll be able to do it. But it's, we just can't do the random come in and we'll do this for you situation right now. You can certainly try doing, we actually have videos, I think, Lauren, that we still have the videos for trimming your pet's nails. That was
on our YouTube.
So, yeah. And cleaning your dog's ears, which Lindsay had done. So you can do those things, but we can't just do the drop-off thing anymore. Right.
And for an example, my dog, Luca, you guys probably remember, is very difficult with nail trims. He used to go to Bulger for nail trims, and it needed 3 technicians to kind of hold him down.
And then we banned him.
Until we started going to Bark of the Town in North Andover, and they use a grinder, and he just loves his groomer there. But like you said, they're not open. So what I did is I ordered a grinder, and I've been trying to do it myself, and I've noticed it helps if you just do like 2 nails at a time, and then just give him like an hour break and lots of treats. And it took me like a week to get all of his nails done, but they're done.
And there are some resources online, like this organization called Fear Free has really great videos for pet owners to use to learn some of these techniques to try to make it not this terrible thing, because most of the time it's just that we approach these things with like, let's hold them down and trim them. And in reality, that's kind of how you have to manage things in like the old school way of let's just get done with our day kind of situation. But yeah, doing one at a time, giving them treats in between, ample use of treats, and positive reinforcement, you can actually do it on your own, even though you may not believe me.
Yeah, no, and
Go ahead, Lindsay. No, you go.
There are going to be certain times too where, I spoke to an owner just the other night about their cat's nails, where the nail itself though is actually starting to grow around into the paw. So I think Krista touched on this briefly. That's going to be a different circumstance. And so if you are noting that the nail is not just long, but instead it's like wrapping around and growing into underlying pad, or if the mat that's there, it's not just a mat and like it's knotty, it's that the skin underneath it looks really like red or inflamed too, then that is when we are there for you to help you out. I mean, those can get infected and things like that. So just a regular old nail trim, just because you don't like how they're looking and they're getting a little bit long, it's really not ideal. And utilizing all those techniques is great. But we are still there to do a nail trim if it ends up getting to be to a point where it's a medical issue.
And with the mats, my tip there is we actually often don't shave mats. So you may not realize this, but a mat, we only will shave it if it is, like Lindsay said, like right up against the skin and causing irritation. But you actually can get a comb, a pet comb, and just when they're sitting there with you, start combing through it. The mat is really just dead hair that hasn't exfoliated and shed properly. So a lot of the time we'll just sit there and comb these guys out and not have to make them look like a horrible moth-eaten creature from the Blue Lagoon or whatever.
They do actually have too, like special combs, so not just your regular comb that you use to brush out your, but special combs for mats that have these sort of very sharp edges on the inside, and so you have to be careful when you're using them. But you basically can rub that comb sort of in there and slowly break away and cut away at that mat. If we're talking about mats and you guys really do want to try to do that, either with a special comb or just regular brushing, just a word of warning that, cat and dog skin is really thin, and so often people will try to use scissors and try to
no.
I just don't want to do that because that is so tricky, because you lift up the mat and you think you're cutting the mat, and you can just cut off a huge chunk of skin really easily on these guys. So just be careful you're not using scissors.
No scissors.
Yeah, groomers are professional for a reason. They know how to use those tools.
It's funny because the Walmart CEO talked about the different phases that the community was in based on items they were purchasing. And so, initially in the pandemic, there was a huge, purchase of toilet paper. For whatever reason. And then he saw, a huge, purchase of games, like for people that have all these children at home, they would buy all these games to entertain their kids. And now they're in the purchasing phase of like hair products. And so we're feeling that too. Veterinary medicine. We're getting all of these calls now about, grooming issues and nails because we're at that point where things have been closed long enough that things are starting to get a little hairy out there. And so, people are calling in.
So we're saying goodbye from the podcast. Please don't forget to check out or rate and review us on whatever podcasting device you use, app you use. And saying goodbye, I'm Krista.
Hi, I'm Lindsay Renzullo. Thanks so much. We'll see you next time.